Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, Discharge Planning Compliance with CMS Hospital and CAH COPs 2025. I would like to introduce our presenter for today, Laura A. Dixon. Laura A. Dixon recently served as the Regional Director of Risk Management and Patient Safety for Kaiser Permanente Colorado. Ms. Dixon has more than 20 years of clinical experience in acute care facilities. I would now like to hand over the floor to the speaker. Over to you, Laura.
Thank you, Christine, and welcome everyone. As Christine mentioned, our topic today is called discharge planning. So I'm going to start with really Appendix A, and that's for the acute hospitals. And for critical access hospitals, you have your own separate manual. The focus for acute hospitals is right here. I've got it highlighted. The reason we do these is so you don't get one of these, and that's that statement of deficiencies where you have to do a plan of correction. Well, the first one, they didn't make sure the patient was admitted with home health services. And then just a few more. So how did this all start? Well, it came from the IMPACT Act, which stands for Improving Medicare Post-Acute Care Transformation Act. So here's what's required. Of those post-acute care providers, so here are the actual quality measures the PACs must report to CMS. They have to do this. For critical access hospitals in particular, have it within their geographic area. What else do you as a facility have to do? Answer their questions on that data to the extent you can. Well, let's go ahead and get into the meat of the topic. And this is the discharge planning, conditions of participation. If you are a Medicare, Medicaid hospital, in other words, you accept payments from them for any patient, whether it's one or all 800, doesn't matter, you're 800 bed, you have to meet these conditions. And it's for all patients. This is the first requirement. You have to have an effective discharge planning process to focus on. So that's why we want to include that caregiver in the discharge planning process for care once they leave you. I want to mention Blue Box real quick. This is in the actual manual. So as far as who's to be included in the planning, so overall, your discharge plan. There are other evidence-based studies, how you can reduce readmission. So other ways, maybe we send them to rehab for a week. So back to the process. You have to have a process that really finds out at an early stage if this patient is going to have an issue when they're discharged. So for the physician request, let's start with that one. Overall, you have to reevaluate this patient while they're there. So you have to look at your overall process on an overall basis. Post-acute care data provider. Provider data, excuse me. Here I've got the two tag numbers up in the upper right-hand corner on timely discharge evaluation. Provide a discharge evaluation for those identified. So your evaluation, again, three ways. As far as the likelihood for either going to a post-acute care or taking care of themselves, can the patient do that? Do they have the capacity for self-care? What are the likely needs this person's going to need services? Let's talk first non-health services. What about you have a patient who's in a facility before they came to your hospital? Because there's other expectations. In the medical record, it must be included in the record. That's not an alternative. You have to have this discharge planning in the record. Here's some factors to consider. So let's move over to communication of patient information. CMS put out a memo, and it reiterated those requirements that you have this effective discharge process. In short, a lot of the PACS information hadn't been sent along. There were 6 areas of concern. All right, PACS services, home health, they have to be listed. They have to request to be listed as available in the area. So what do you have to do? You have to give this list. Again, these are your acute hospitals. Overall, it's up to the patient. They have that freedom to choose. Something else you have to do is you have to disclose if there's any financial interest that you as the hospital have. On the initial implementation, so you've done your evaluation, and now you've been asked to, let's get this thing in place. What do you give them? Instructions on those options. And then the ever-present documentation. Reevaluate your plan. Include in there what you're going to have as far as participating in Medicare. Disclose that financial interest. So here's one that's new. Transfer to a facility, and we send along the information. What information are you going to send? If they're going home, other information. Assess your process on a regular basis. Assessment overall, and this is of your program. This is effective January 1. It's transfer protocols. You must do annual training. Critical access hospitals. Again, they updated your manual in 2020. An effective discharge planning process that focuses on their goals and preferences. The evaluation must be done timely. What is the likely need that they're going to have these services? It must be in the record. Here's your qualified people. You must have a process to regularly reevaluate that person's condition, Recess your process regularly. Assist them in selecting it. Same thing, you have to discharge and send information to where they're going. Other considerations, so for your criticals, here's your differences. This is performance metrics on your discharge planning process. Include these as part of your QAPI. So here's just some summaries. So just a few key takeaways. Look at your patient. Ask them, where do you want to be when you leave us? And make sure you're done timely. This is going to involve, make sure that you have documentation that shows what you did and when you did it. Thank you for attending. Christine, I'll send it back to you to close us out. So again, thank you everyone, and thank you, Christine.
Thank you, Laura. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day ahead.